the Childhood Cancer Perspective, and thank you once again for sticking with me through this journey on childhood cancer from the point of view of a parent and as siblings going through this from a diagnosis to the treatments and to the unfortunate passing of a child as seen from our point of view, a view that maybe not too many understand. And I'm hoping that this podcast helps you relate a little bit to certain situations in a way that you can understand us better, and maybe reach out to that person that's going through something and give them a little bit more comfort because you better understand possibly what they're going through or what they're feeling at any given time. Today I wanted to talk about something that is probably going to be a very hard topic to discuss, but I feel like it's very necessary. And it's a topic that definitely will bring out the emotions in anybody that you're speaking to because a pure word generates emotions and generates fears that I think are understandable, but at the same time, I want to talk about a side of it that is comforting in a sense. In that word is hospice. Everybody, I think, understands it doesn't have to be cancer. It can be any type of serious and terminal illness, but everybody understands what hospice care is, or even just end of life. It doesn't have to be by disease. Hospice care is always considered and is there theoretically because of somebody getting close to the end of life. In our case, obviously, we're talking about pediatric cancer. We're talking about our daughter and going through her treatments, going through all the phases of the treatment from chemos to radiations to high dose chemo, stem cell transplants, um, to shunt, both surgeries and shunt revisions, having her port put in, removed, and also having a Hickman catheter placed so that she could have certain other types of medications put in during the later treatments. Going through all of this and then getting to a point that you hear from the doctor or the team that there's nothing more we can do. We have reached a level of care, we've reached a level of treatment, we've reached a level of our ideas and our knowledge bank in the ability to draw from clinical trials and everything, all of that spectrum. We've reached a point where there's nothing else we can do. The best thing that you can do, and this is one of the hardest things that you're going to hear as a parent, the best thing that you can do is go home and make memories. Go home and cherish the time that you have. And listen, at this point in time, when you go through this hospice care, your child could be happy. They could be jumping around. They could be giggling and playing like there's nothing going on. However, their cancer in their body has reached a point that it is no longer responding to the treatments and no longer responding to um, what therapies that you're throwing at them and throwing at the cancer. And so therefore they reach a point where they say, hey, there's nothing more we can do. It's the best time now to go home and to make memories, to enjoy the time you have, to make them, you know, make them smile and remember everything. Get a camera, remember everything right now, because unfortunately, they're in that stage where their body is beginning to reject all the treatments, or their body is at the point where they're shutting down. It's no longer responding. Now's the time to go home and be with your family. Now, hospice care, again, like I said, is it's a scary word because you hear it and you think end of life, you think things are over, you think it's going to happen quick, you think that, oh my God, this can't be true. But the reality of the situation is that hospice is very, very, the word is scary, but the hospice care in general is actually very comforting. Um, Now, in our personal case, JC was put on hospice care after she was, we were in Green Bay because she was having trouble breathing. She was having trouble getting over something that she had contracted, just some kind of respiratory um, virus, and she could not catch her breath. She was having a lot of trouble breathing, a lot of trouble kind of getting up the stuff that was, keeping her from um, communicating with us. And so we were actually airlifted to Milwaukee, and it took us and we were not able to fly with her. She was in the helicopter, with the doctors. They flew to Milwaukee. I came home, got my wife. We drove to Milwaukee. By the time we got there, they had her, hooked up to everything in the ICU, and They did all their stuff, and it wasn't too terribly long after that we were pulled into a room to show us her scans, to show us blood tests, and to show all of that, to tell us there's nothing more we can do. We have done everything we can do. The stem cell transplant, like, the stem cells work. She never developed graft versus host disease. Her blood cell counts came up really fast. We were out of the hospital quicker than they had expected. Like, she actually rebounded really well. Unfortunately, she had developed leptomeningeal disease, which, you can look that up. She also didn't develop hydrocephalus. It was pressure in the brain, so it's kind of like that. But they ended up putting another shunt in, and so she had two to try to help keep the pressure down. And we got there, and after all of this, after everything we had gone through, they pull us into a room and say, "There's nothing more we can do. It's at the point where you need to just be with her. You just need to be with her and comfort her, and quote unquote make memories," which is, normally speaking, making memories, that's a good thing to do, right? You always want to make memories. In the case of pediatric cancer, in the case of terminal illness, making memories means the end is coming. We were, of course, devastated by this news. And my wife actually got up and left the room. I stayed in there. I was angry. I was not happy. My emotions for the devastation had not really come on to me. What had come on first was the anger. Angry that we were, number one, flown all the way to Milwaukee for to be told this, and angry, number two, that essentially I felt like the doctors were giving up. Telling me there's nothing more you can do means you're giving up. They told us, "We want to send you home in an ambulance because we feel like she's going to code on the way home," because that's how bad off they thought she was. And at that point, we said no. We said, we're not going home in an ambulance. We're not staying here, because we are not going to have this. If this is the last time that this is it. She's not going to see this room. This is not going to be her last vision. So we signed her out against medical advice. We signed her out. We said, we'll sign the forms. We're taking her home. By the time we got home, we were already getting calls and having meetings and setting up hospice. We had, in total, we had nurses come that do her vitals. That we had equipment show up so that we could give her feedings still, because she was on NG feedings. So we had equipment for that. We had equipment come in to give her medicines. We had medicine shipped to us, syringes by the thousands, for um, saline cleanses for her heparin, or for her Hickman catheter, as well as heparin locks, so that we could do that properly. Um, moist the wipes, the alcohol wipes. We've got about 1,000 of them still. All of the supplies that we needed were shipped to our house, and literally within a day. And then any medications that she was on, that was all transferred to the hospice team. They handled everything. So, in a sense, and when you look at it like this, hospice care is a very scary thing, because when you go on hospice care, that means the end is near. That means that they're expecting that you are going to pass soon, or somebody's going to pass soon, because there's no more medical care that can physically be done. But nobody really looks at hospice care, I think, or at least from my standpoint, looks at that hospice care and sees the benefits. And the benefits are simply that your child, in this sense, is going to be cared for in such a way that their comfort level is of the utmost importance. And while you're being in the hospital and you're there for long periods of stays, they do really well at trying to keep you comfortable, keep you happy, keep you smiling. Their main standard is that, all checking all those boxes, making sure your vitals and levels are all the same, checking you every hour, pushing medications, all this stuff. That's their job, and that's commendable. But hospice is meant for comfort. Hospice is meant to make you feel comfortable, make you not really forget about what's going on, but be at peace with what's happening, and give you a sense of just relief, that you don't have to worry. Because when hospice came in, like I said, they took over the medications, they took over handling, talking to the doctors, they took over talking to any hospitals, all of that. They basically take care of all of the paperwork, the phone calls, the headaches that you deal with, as a cancer parent, up until then, they take it over. It's actually, like I said, it's really a comforting thing. And the people that came in that did hospice care for us were absolutely incredible. They were just the nicest and sweetest people on the planet. And the reality is, they told us they don't deal a lot with kids, and it's very hard to deal with kids being on hospice care, because it's a child that is potentially on the verge of passing, and they're not used to seeing that or used to dealing with it. So they're obviously versed in what they do, but dealing with a kid versus with an adult is a very different mindset to be in. They were incredible with JC. Just they would talk to her, they would explain everything in depth. It was basically, we're getting your permission to do things, making her feel as if, giving her that control that she so demanded and so deserved, giving her that control at that moment, making her feel safe. Um, we had we had her on an oxygen machine that they brought in when she was on hospice. I had oxygen hoses running all over the house for her bedroom and for our bedroom, and there was one that was out in the living room. So that in the time that she felt like her oxygen levels were dropping, or it was harder for her to breathe, we would put her on oxygen. It would help her. It would really calm her down. Um, and like I said, we had all the drugs and feedings, and everything was all set up through them. And for us, we had JC was on hospice care for 12 days. She was on hospice care for 12 days before she passed. And the one thing that I can tell you is that the day or the evening that she passed, um, we had to call the hospice nurse, because that's what you do. You don't call 911, you don't call any of that, you call hospice. Everything is through them. And we had officially signed a DNR, because we felt like, at her stage at that point, and the way her body was and the way she was recovering from things and all of that, that in the sense that she did code, or she did go into uh, heart failure or anything like that, that it would be more peaceful for her to just pass away and go to sleep and pass away, than it would be for them to try to revive her, potentially hurt her physically, and bring her back to a position where she was essentially in a vegetative state. So we made a decision that the DNR was the best way to go. And we so when things happened, we called the hospice nurse. They gave us some instructions, and then we got her into her bed, and we laid there with her. And my wife went and got her sisters, and they came in and they said they loved her, and they said goodbye to her. And then they couldn't physically stand there. They had to go, and um, my wife and I stayed there with her until she passed. And the entire time that we were there, that nurse left us alone. She sat in the room with us, but she sat on the floor. She left us alone. She allowed us to be with JC. She every now and again she would check her heartbeat when it didn't seem like she was breathing too much. And um, she was just there for us. And she would talk to us. And I remember that um, when JC finally took that last breath, I had my head on her chest when she did it. And she took that last breath, and I could hear her heart stop. I could feel it stop. And I knew she was gone. And she came over, the nurse came over, and she checked, with her stethoscope, and she said, she's gone. And I think at that point, it was it was real up until then, but I think at that point it really hit that your child's heart has just stopped, and her breathing has stopped, and she's done. She's no longer with us anymore physically. And I remember the nurse just, with both my wife and I were there, I remember that she just put her hand on our backs and rubbed our back and said, it's okay. She said, I'm sorry. And she was so strong and so beautiful. And we said, yeah. And my wife told her, she goes, just keep chasing those rainbows, baby. And and then for the next few hours, the nurse, went out, to our kitchen, and she was, filling out all the paper because there's a lot of paperwork that goes on when somebody passes, and they had to fill out all the paperwork, and we had to make a decision on a funeral home and stuff like that. But I just remembered that my wife went out there to speak to her and talk to her, and the nurse was crying, um, because they're real people too, and it proved so much in that moment the humility of somebody that had no idea who Jace was except as a patient. And when you're in the hospital for hundreds and hundreds and hundreds of days, you're you become a patient, you become a number. Yes, you will meet some amazing nurses and amazing people along the way that will personalize with you and will understand who you are and will know your likes and will speak to you like a true person and not just a number. But with hospice, because they have a focus, and that's their focus is that person, and they all spoke to her with such respect and dignity. It's something that she so greatly deserved. And they did everything they could to ensure that not only she was comfortable and she was safe and she was happy and understanding of everything that was going on, but that her mother and I were too. Um, it was something that was truly, although a terrible, terrible experience for us, and a terrible experience for any parent to watch their child go through that, to see their child take their last breath, to listen and feel their heartbeat stop, to have somebody there that doesn't know you, that's not a family member, that's not a friend, they don't know you, but to treat you with such respect and to treat your entire situation with such dignity and give you the power that you just didn't feel like you ever had. So my our personal, and I apologize, this is emotional, probably one of the most emotional episodes to talk about something like this because you know what JC went through in those 12 days was nothing short of, on her part, heroic, on the cancer side, horrific. But in those days, I feel like she felt like she was in control. She felt like she was safe. She felt like she was at peace. Um, I tell the story often that that morning, early, early morning, when she woke up the second time, and um, she woke up that second time and she was having trouble breathing, and we're holding the mask on her face to try to get her to breathe and try to get her to calm down. And it's not anything that she can control. I know that my wife and I were tired and probably frustrated, not with her, but just with everything. And it was like, you gotta calm down. You gotta calm down. Just breathe, breathe. And she's trying, and she can't control what's happening. But one of the things that sticks with me the most, one of the things that sticks with me the absolute most, is that when I looked at her, when she's sitting there, breathing in and out, almost like having an asthma attack, if you want to compare it to that, breathing in and out so hard, having trouble, I looked at her in her eyes and I said, "Are you okay?" And she shook her head yes. And to this day, I believe, because it was within minutes after that she went into the sleep, that deep sleep that she never came out of. And the last thing that she did for me was that she shook her head yes, that she was okay. And I had asked her prior, way prior, to get off on a tangent. I asked her way prior if she was scared. And this was, during this 12 days, I think I said, "Are you scared?" And she said, "No." There were days, I made videos, you can see it in her face that she was in tears. And I think it was because she was just over all of it, just so tired of it. But that moment, for her to look at me and say, "I'm okay," and look at me in my face and give me, and I I am convinced at this point, not being a super religious person, but really trying to understand, I am convinced at that point that either Jesus or an angel, somebody from our past, a guardian angel was there with us at that moment and was holding her hand, telling her it's okay. It's okay to let go. They're going to be okay. That moment was probably the hardest thing to hear her say that. But I was so proud of her for being so strong when we couldn't, being strong for us. And I think that during those 12 days, I think that hospice gave her a lot of that strength because it gave her the sense of I'm in control, the sense of everybody is here for me. Everybody is here to make sure I'm okay. The sense of I'm not just going to the doctor to get drug treatments and come home. I'm not just going to the hospital to stay for 40 days and then I have to come home and feel like shit. I'm going to go, these people are coming to my house, to my room, my beautiful brand new room. They're coming here to make sure I'm okay. They're coming here to check on me. And I think that made a lot of the difference. I think it made a huge impact on her life and a huge impact on uh, her psyche and a huge impact on her spirit to know that these people, this amazing group of people, was here for her for the first time in 520 days. People came to her and she didn't have to go to them. Hospice care is a very scary thing. And some families, when we had another family that we followed that their child actually had the same type of cancer as JC, and he was on hospice care for almost a year. JC was on hospice care for 12 days, and I think we probably could have been on hospice care sooner, but there were still kind of glimmers of hope that we were going to find some other treatment or some other type of therapy that was going to help her, and we we just never got to that point. We tried, uh, but like I said, yeah, this other family was a year on hospice care, and the child gradually did really well in the beginning. Actually, looked like he was thriving in the beginning of hospice care. And I've said it before. I actually said it recently too. That sometimes that being at home and being around your family, being in your own bed, around your own stuff, just being in your house. JC, when we came home originally from the hospital, when she was done with her treatments, this was before hospice, she spent 90% of her days on the couch. We had a big giant stuffed bear that's still in her room that we laid on the couch, and she would just lay there, and she would lay there and chill and watch TV or play on her phone and play with her cat. Like, that was her place. She just stayed there, and that she recovered so quickly, um, once we got her home versus how quickly she was recovering when we were just stuck in the hospital. It's so incredible what that home environment can do to your psychic, your mindset, and to all of that on the internal side that really correlates a lot, I think, with the medical side, because you're not as stressed, you're more comfortable, you're relaxed, you're able to just decompress, and it makes so much more of a difference, I think. And like, so JC did really well when she was at home, and this other child, he did really well in the beginning, and then all of the drugs and the leptomeningeal, he had this, I mean, the same type of side effects, they all started to catch up with him, and he started to show all the side effects of going through all of this and being on certain types of medications, the same things that we saw. And unfortunately, he ended up passing away, but it was, like I said, almost a year that he was on hospice. And there's no indication, like, there's no right or wrong number when it comes to it. Hospice care is there when there's no more medical treatments that can be offered. at that moment, and there's no there's no more updates or no more treatments that can be done. You've reached a limit of everything that the doctors or even society has in their toolbox, and so they say, okay, now it's time to go home, make memories, enjoy life the way that it is. I think adults, I think they're saying, okay, well, we're on hospice care, we're going traveling, we're getting the hell out of here. Um, we're not going to sit here and just wait for something to happen. And what some families do too, they take their kids and they go travel as much as they can. Unfortunately for us, by the time we were put on hospice care, there was she wasn't safe to travel. There was no way we could do that. Had she been put on hospice care 6 months earlier and that was it, I think we probably would have traveled. We would have gone to Disney or something like that with her, which we had planned to do the year that she was diagnosed, and then COVID, crapped all over those plans too. So, I think you look at hospice care as a very scary thing, but I think hospice care can also be a very comforting thing. And I want you to take that away from this episode, knowing that if you're ever in a position like this, or you're listening to this podcast as a parent that has a child going through this, and you hear the words, what, it's time that you need to go home and make memories. It's, we're gonna set you up with hospice care. Don't be scared of it. It's not a fun thing to talk about. Um, it's not something that anybody wants to hear. It's not something that anybody wants to plan for. But at the same time, be open. Be open to the possibilities. And when I say the possibilities, I mean, number one, hospice care doesn't have a time limit. There's, like I said, for us it was 12 days. For this other family, it was a year. For some people, it can be more than that. Some people, it can be less than that. There's no number. So when someone comes in and says, yeah, we're gonna have to sign, your child up, or we're gonna sign you into hospice care, sign over everything to hospice care. That doesn't mean that you need to say, okay, well, that's the end. It just means now is time to really, really get in those memories. Take a time, take a vacation. Um, you know, bring family in from out of town. Have a party, whatever. But also just understand the possibilities, what that means. And the positive side is that means you can stop with the scary trips to the hospital. You can stop with the scary trips to the doctor, the scary phone calls, the testing every day, the blood tests, all this stuff. It's done. Now, JC did have to have blood tests done when she was in hospice, but they took it all from her port, so she never had to have any needle sticks or anything like that. And, and that was just for, they would test everything so they knew how to properly measure her medications that they would send out. But I guess what it comes down to is just, when you hear those words, yes, it's okay to be scared because it is a scary thing, but don't close your mind to it. Just be open to what that means, because yes, it is set up for end of life, but it can be a positive thing in the sense that now you can just spend that time with the child, not worrying about the next test, not worrying about the next MRI, the next CT, what the next blood test is going to show. Yes, they've done everything they can, and right then and there may not be anything, but maybe something comes up while they're in hospice. You can't look at it as closure. You have to look at it as another step. And hospice care can be an extremely comforting time because everything then is taken off of your shoulders. All that weight that you've carried and all the weight you have had to struggle moving around every day for their care, you're still in charge, but everything is handed over to the hospice team and they handle everything. And it does take a definite um, a weight off of you, and it gives you an ability to just breathe and just focus on them, and that's the point. So if you hear those words, I understand if you're scared, and it makes sense. And I can understand if you're angry too, because when I heard nothing more could be done, I was angry. But I didn't understand hospice care because I had never been a part of it. I never had a family member that was on hospice care, so I didn't understand any of it. But you just hear it and you're scared. What I'm telling you, be open. Be open to the possibilities of just being able to then focus on your child and your family without worrying about anything else, without all the deliveries, without the medication renewals and prescriptions and all that stuff. It's all handled by them. it takes all that weight and burden, gives it to somebody else, and allows you to focus. So that's going to be the episode for today. Hospice care can be a scary word, but it can be very comforting, and it can also give you the ability to really go out there and make some amazing memories and do it like you. I mean, we always. I mean, I. You live like there's no tomorrow. You're supposed to live like there's no tomorrow anyway, with no regrets. You're not supposed to live with worrying about what you said yesterday or what you might do. You're supposed to just live for the day. So live for the day. Take your child, take them out, do something fun, do something amazing, bring somebody to them that makes them feel incredible. Bring family in, go to a movie, just do something that they love to do, and just make it all about them. Finally, no more, hey, we've got to go to the doctor tomorrow, it's time for another needle stick. No, none of that. Just make everything about them. It's an incredible way to just be with them and just spend that time with them, and just enjoy your the moments, enjoy life. So I apologize. Sometimes I do ramble. I have been told that I ramble. It's my bad. That's how I can get 30 minutes out of this podcast. I hope everybody listens the whole entire time. I do intend to keep these up. I'm hoping to get an episode. I keep saying it, but it's very hard to nail people down. I'm hoping to get an episode out soon where I can have my daughter in here with me, and she'll be on camera and she can just kind of talk about her experiences, just in general. I think we'll just have a conversation, and you'll get it from a child's point of view that's going through it. And hopefully I'll do another episode with my wife as well. We can do the same thing, just kind of come in here and speak about our relationship, to speak about our journey, or shit show as my wife will call it. Speak about, having other kids and them going through their milestones and things like that. But that's coming soon, so please stay tuned. Please continue to share, like, listen to this podcast, and give us feedback. Give me feedback if there's something you want to hear me talk about. If you've always had a question about something, now's the time to ask. Thank you very much, everybody, for sticking with me this long, and I'll see you next week.